Move on to question 6. I call on the Honourable Member for Arbory, Castletown, Malew, Mr Moorhouse.
Thank you, Mr President. I'd like to ask the Minister for Cabinet Office on what dates the Directorate of Public Health A. advised the policy that masks should be worn in schools, B. stated that this policy should be classified as an expectation, C. reassessed the policy on its classification, and D. reaffirmed them to the Minister, the Department for Education, Sport and Culture, Schools and others. Thank you.
Minister for Cabinet Office to reply.
Thank you, Mr President. I thank the Honourable Member for his question. The topic of face coverings has been a consistent area of interest throughout the pandemic and has regularly featured in discussions and reviews on the island's policy at different times. These reviews have been at multiple levels across the whole public service, including within DHSC and Public Health, with Clinical and Public Health Advisory Group, and within the Bronze, Silver and Gold command structures which have operated throughout the pandemic. Ultimately, though, all decisions around national policy flow up to the Council of Ministers, who have monitored the situation regularly, often weekly and in some cases daily, as the situation developed. It is important to stress that whilst Public Health provide advice as part of any decisions, ultimately the decisions surrounding non-pharmaceutical interventions, including mask wearing, have been a matter for Council of Ministers to determine, and also for this Honourable Court, where such rules translate to the public health regulations, and these need to be balanced up by many facets, not just the direct public health considerations. More recently, in October and November 2021, Council of Ministers met a number of times and specifically developed the winter strategy, which was published on the 12th of November, which set out the 3 levels of potential situation and response. Level 2 suggested that face coverings may be increasingly expected to be worn in settings where it is difficult to distance. This framework was developed with input and support from Public Health. On the 28th of November, as a specific response to the increasing threat of the new Omicron variant of concern, it was announced that the island was moving to level 2, and as a result, face coverings would become mandatory on public transport from the 30th of November, in line with the stance taken in England, and would be expected in all other indoor public settings in line with the winter framework. This included educational settings for secondary pupils and teachers. These decisions were reached by the Council of Ministers in consultation with Public Health and in consultation with the Department of Education, Sport and Culture. Since this point, the position surrounding Omicron and the island's response, including public health guidance, has been reviewed on a number of occasions by Public Health, by the National COVID Response Group and by the Council of Ministers. The position in school settings has also continued to be regularly reviewed by the Department for Education, Sport and Culture. The specific dates on which the Omicron situation was subsequently discussed by the Council of Ministers with Public Health present included the 28th of November, 2nd of December, 9th of December, 16th of December, 31st of December, 6th of January and the 13th of January. If the Honourable Member would like to know any further specific dates that precede this latest decision, I would gladly ask that Public Health provide that to him directly. Thank you, Mr President.
Supplementary, Mr Moorhouse.
Thank you, Mr President. I'd like to thank the Minister for attempting the answer. My concern is that in terms of the question, it was quite clear in terms of dates required for specific areas. And in terms of the answer provided, I only got a list of dates at the end of the answer. Do any of those dates apply specifically to any of the 4 areas asked for in the question? Because the Desk Minister has made it really quite clear that public health guidance was the key influence in the department's policy, and without actually having the link from public health, which you're providing this morning, it's hard to see what was provided when. Are you able to actually link some of those final dates to the actual initial question, please? Thank you.
Minister to reply.
Thank you, Mr President. I think the point is that each step of a decision being taken or a policy being settled, there is an ongoing link in with Public Health where their advice is given and is taken into account. So those are the specific dates that I can particularly draw to. But I think that there is a context here that needs to be understood, that it is about that overall look, and Public Health is involved and Council of Ministers take on her view. Thank you, Mr President.
Supplementary, Mr Moorhouse.
Thank you, Mr President, and thank you, Minister. in a slightly difficult position here from having private correspondence that does bring into question some of the things being suggested in terms of the strength of public health guidance and the failure to get a clear answer in terms of what advice was given when from the minister responsible for that area. Is there any way in which you can actually clarify what specific advice was given with regard to these 4 areas to the Education Department? Because at the moment, I don't want to be waving a piece of paper going, this is not what I've been told, but at the same time I feel it's important that it's on the public record what specific advice was given with regard to these questions. Is the Minister able to do that, please? Thank you.
Minister to reply.
Thank you, Mr. President. I mean, the question initially is about on what dates the Director of Public Health has advised. I've explained that there is ongoing and continuous advice when Government Council of Ministers makes its decisions. You know, there is no further way for me to break this down other than to say that when Council of Ministers, the COVID response group, considers policy formulation and response, that public health advice is taken account of. Thank you, Mr. President.
Final supplementary, Mr. Moorhouse.
Thank you, Mr. President. In terms of public health's suggestions to the Department of Education, is the Minister able to provide any clarity in terms of the response of the Department to that information? So if, in this case, the Education Department says that mask wearing is expected, are we able to confirm that that is the advice that has been given by the Directorate of Public Health, that masks are expected to be worn in a school setting? So in terms of the B part of the original question, can you actually say that the Director of Public Health has clearly stated that there's an expectation that masks should be worn in a school setting?
Minister to reply.
Thank you, Mr. President. Regarding the dates and the Department of Education, Sport and Culture, there's been at least 11 scheduled diarised separate meetings, and I can write to members to provide a full list if required. There has been, in addition, there's been calls to discuss matters. Clearly, when it came to the point about masks being expected, that was something that was set at a national level, and then for also departments and schools to interpret and take their own actions on that. And public health advice applies to the overall policy. If you want some more lists of dates to do with schools, I can say that on the 6th of October there was a meeting to do with the current COVID levels within schools. These are from the Public Health Diary. A meeting on the 8th of October to do a review of schools with the Deputy and the Chief Officer of DESC present. And there are just lots of lists here that I can provide with dates. I can provide them separately. I hope the overall point is made that her advice is taken, and I could list out all these dates, but I think that would only serve to further represent what's happening at different levels and in multiple ways to make sure that people are getting the advice that's needed from public health. Thank you, Mr. President.